It's recording already.
Infectious diseases are disorders caused by organisms such as bacteria, viruses, fungi, or parasites. Many organisms live in and on our bodies, and they're normally harmless or even helpful, but under certain conditions, some organisms can cause disease. So my first disease is rabies, which is a viral infection. Some symptoms of rabies include fever, headache, excess salivation, muscle spasm, paralysis, and even mental confusion. And here are some pictures of not so good looking people that have rabies. The rabies virus is approximately 180 nanometers long and 75 nanometers wide. You can see on the actual virus itself there's a lot of pokey things that come out that attach to the host cell. Some history about rabies. In September 1931, Joseph Lennox Pawan of the Trinidad in the West Indies, a government bacteriologist, found foreign bodies in the brain of a bat with unusual habits. In 1932, Pawan discovered that the infected vampire bats could transmit rabies to other animals and humans. That's a picture of him in the middle. Contraction. Rabies is mostly transmitted to humans and between animals through saliva of infected animals. Transmission is generally through a bite from an infected animal, and between humans, rabies is extremely rare, although it can happen through organ transplants or through bites if someone decided to bite someone else. It is preventable. Some things you can do to prevent rabies is to report stray or dead animals, avoid contact with wild animals, beware of bats. You can vaccinate your pets and exclude wildlife access to your homes, which can include cleaning your garbage cans and not leaving garbage around to attract raccoons. Treatment is relatively simple. You should gently irrigate a wound to decrease chances of bacterial infection. You should get post-exposure anti-rabies vaccinations, and they should include both passive antibody and the vaccination. The next virus is viral gastroenteritis, or commonly known as the stomach flu. Some symptoms include diarrhea, cramps, nausea, vomiting, and low-grade fever. And you can see on these pictures, these people do not feel very well. They're sick. The actual virus that causes it is called the norovirus. It is the most common cause of the stomach flu. It is highly contagious, and although unpleasant, the illness caused by norovirus is generally mild. It was first called the gastroenteritis in 1825, so it's been around for a while. The virus is transmitted by fecally contaminated food or water, by person-to-person contact, and via aerolization of vomited virus and contamination of surfaces. Some ways to prevent it include: you should use soap and water, not hand sanitizer. Use bleach as a cleaning agent. Wash the carpet with a steam cleaner, and avoid contact with sick people. You can also drink a lot of orange juice, and soup. And these are just some of the ways that you can get rid of it or make yourself feel better. The next is a protozoan disease called toxoplasmosis. Some symptoms include fatigue and weakness, skin rashes, swollen glands, fever, sore throat, muscle ache, swelling of the lymph nodes, and headache, all of which can last for weeks. These symptoms are common in adults, but if a baby were to have it, the disease can affect the lungs, liver, eyes, muscles, the gastrointestinal tract, or the baby's heart, and later the baby can suffer retardation, blindness, mental severe visual impairment. So the actual parasite is called Toxoplasma gondii, and it is an obligate intracellular parasitic protist, which means it cannot reproduce outside of its host cell, so it needs to find some place to reproduce. A little history about it. Toxoplasma gondii was discovered in 1908, but the first confirmed case of toxoplasmosis in humans was in an infant girl delivered by C-section in 1938. 3 days after birth, she began having seizures, and the doctors noticed lesions in her eye. She passed away after 1 month, and the autopsy found that there were brain and eye tissue had lesions, and both contained the Toxoplasma gondii parasite. And they found it first in the sheep, and then from the domesticated animals, it eventually went into cats, which I'll talk about soon. So basically, you get it by when a cat eats a mouse that had the parasite, and so the cat eats the mouse, and then in the cat feces there's the oocyte of the parasite, and when a pregnant woman or anyone really scoops the litter of the cat and doesn't wash their hands correctly, and then they get the parasite, it can lead up to a lot of problems for both the mother and the fetus. And those over there are some of the symptoms that the baby and the mother can have when they get the parasite. It can be prevented if you can handle and cook food properly by cleaning and cooking your meat well. You should clean cat feces daily, avoid cat feces when pregnant, and people with weak immune systems should use preventative medications. The basic treatment for this is just medication, antibodies. The next is candidiasis, or yeast infection. It's a fungus infection. Some symptoms include itchy rash at the affected site, inflammation, thick white vaginal discharge, white lesions on the tongue or inner cheeks, and discoloration or thickening of the nails. The actual fungus is called Candida albicanus. It is a normal fungus to have in your body. Good bacteria keep the fungus in control. However, when conditions are right, the fungus will overgrow and have an effect on your digestion, weaken your immune system, and even damage your intestinal wall, penetrating through the bloodstream and releasing its toxic byproducts throughout your body. Hippocrates described oral candidiasis in around 400 BC. However, in 1839, Langenbeck discovered the fungus in a patient with typhoid fever. However, it was not until 1954 that the 8th Botanical Congress officially endorsed the Latin phrase Candida albicanus as the biological name, formally ending the 200-year-long uncertainty over the causes of this disease. So, how you get it or develop it, changes in organism balances can stimulate overgrowth. Taking antibodies, high estrogen levels due to pregnancy or hormone therapy, and certain diseases like diabetes and HIV can cause yeast infections. It's most common in pregnant women because there's a lot of changes in their bodies and a lot of hormones going on. Basic treatments are, again, just antibiotics, having good hygiene and controlling any diabetes or HIV infections. And you can treat it by honey, cranberry juice, and certain antibiotics.